Hello everyone, my name is Clara Sauls, and I'll be discussing this week's discussion, which involves leakages among practices. We were asked to consider from our reading and video assignments to do our own research in which we need to identify a topic of a nursing skill that has changed as a result of evidence-based practice. And then we were asked to identify 3 nursing skills that you feel more research is needed by addressing what type of research should be conducted, the projected patient outcome, and project cost confinement. One essential topic that affects patients would be implementing evidence-based safety protocols. They are difficult and are needed to strategize a better way to address the complexity of systems of care. In order to change culture to become more evidence-based safety practice, it needs to become more adapting to the evidence-based practice used in our daily researches, activities, or our daily lives. One of the biggest piece of framework involves turning that research into practice that promotes effective interventions in which adapts the evidence-based assessment on acute pain management in older patients. The goal is to provide implantation interventions for evidence-based practice in the healthcare field. After reading a research study based on improving nursing advancement in their careers, it helped to focus on 3 essential nursing skills in which promote the nurse with their interpersonal, organizational, and technical skills, which ultimately promote better patient-centered care and patient safety. It also promotes better pain management as well. Some interpersonal examples involve active listening, which is important in travel nursing to practice your active listening skills. Communication, written and verbal communication skills that are equally critical in this field. There's other examples that involve personal issue, stress management, compassion, attitude, teamwork, and problem solving are also examples of interpersonal skills. Organization skills help nurses to keep deadlines, provide better delegation of tasks, which promote goal setting, decision making, and managing appointments, teaching management, and making schedules that promote patient-centered care, such as assigning a nurse who specializes in cardiovascular practices with a patient who has cardiovascular needs. Technical skills are essential special skilled nurses use when working in a cardiology unit. They need to become specialized in working with telemetry devices and advanced life-saving training. Another example can be a nurse working in the pulmonary unit where chest tubes, ventilators, and airway management are used. It's very essential to know these skills because these affect how the patient breathes, affects their circulation in their airway. Other examples can also be taught with technical skills in which help improve nurses' ability and tasks are the gastric system, neurologic, endocrinology, wound care, and oncology. These skills help nurses to promote better safety and patient outcomes. The type of research that should be conducted involves evidence-based practices that involve randomization of controlled trials that are elevated by evidence from scientific methods such as descriptive and qualitative research, which is where information comes from expert opinion, case reports, and scientific principles. The projected patient outcomes involve engaging in healthcare personnel who are the pain of selecting and prioritizing patient safety practices by the use of qualitative or quantitative data, which helps to measure their near misses, adverse events of medications, and injuries noted from adverse events that is coerced through clinicians about the evidence-based rationales of completing fall risk assessment to promote better safety. So what I'm trying to say is that patient assessment is crucial. Inflammation is crucial in nursing care. Based on our assessment of how a patient can fall affects how the interventions of giving someone cardiovascular meds increases their likelihood of falling. So it is important for nurses to know their skills and how they implement them. Other things that can be addressed with nursing care is education teachings. Some older adults or children need more tools and skills in order to understand how to promote their safety, such as when getting up when blood pressure is low, or if they have a fractured leg, being a one-on-one transfer or two-to-one transfer based on what is assessed from physical therapy. It's just very essential for nurses to know safety guidelines for all patients. They need to have a safety assessment. The evidence-based practice improves the patient safety by practicing different types of inflammation interventions that promote different ways to keep a patient from falling. After implanting interventions to promote safety, it is important to elevate the outcomes to improve the patient's safety on the positive impact of quality. Another example that can be used is a patient's pain. If a patient is in a lot of pain, some may shake, some may not move, some may just stare. As nurses, we need to know that treating pain also promotes safety. If a patient's in a lot of pain, they may get out of bed and go to you to get a pain pill, which may cause them to fall, may cause a fracture, or etc., cause hematoma if they fall on their head. One example of project cost containment involves maintaining expenses to prevent unnecessary spending or thoughtfully reducing expenses which benefit and improve profitability without asking long-term damage. So I try to think of an example that would really benefit patient safety of outcomes. An example I came up with was how involving the use of blood products may cause allergic reactions in patients. So maybe using a new barcoding system will help result in fewer blood transfusion errors when administering blood products. This also gives the precaution to prevent the patient from staying longer in a rehab or hospital while promoting less allergic reactions and patient safety related to the blood being infused. The project cost confinement should just focus on how we can reduce our spending with patient safety. Is basically do a fall assessment test and to always double check the medications that are being given. Other than that, thank you so much, and I hope you guys have a great day.